Great pleasure to have with us Rich Besser, the new, somewhat new, head, 2 months, the veteran head of the Robert Wood Johnson Foundation. Most of you know him from TV, where, like Jackie Judd, he was former ABC Alumni Society here, and also acting head of the Centers for Disease Control, right?
That's right.
So really cool. Congratulations on your new job.
Thank you.
And on all of your old jobs.
Thanks so much.
I want to get into what it's like to run a foundation at a time like this when it's so awesomely important and things are changing. But first, let's get to the things that might be changing. Give us a high-level view of what you see the Senate and Congress in general trying to do with the Affordable Care Act.
Yeah, it's the issue on everybody's mind. And when I think about the changes that are coming forward, there are a couple lenses that I apply to that. And one is it going to make it easier for people in America to lead a healthy life? And one of the key things that we work on is access to care, and the objective of everybody having access to high quality, affordable, comprehensive care. And so, we'll be looking to see how the Congressional Budget Office scores that, and whether this bill will increase or decrease the number of people who have access to care. Anything that cuts back on the number of people who have access to care is a step backwards. And anything that shifts the quality of the care is a step backwards. So, you need to look at not just the number of people who are covered, but what is the quality of that coverage? Will they have access to mental health services, to addiction services, to reproductive health services? Those are all the things that you need to look at. And clearly, the Affordable Care Act is a flawed bill and needs to be improved. Yeah. And if there's a way to pull people together from both sides of the aisle to make that happen, that would be a terrific thing. But a bill that moves things in the wrong direction is something that people need to speak up about.
Yeah, I see Dan Glickman here in the blue blazer there, who has really been pushing on this notion of you can pull people together from both parties if you really tried. But the entire notion of health care coverage has been done initially by President Obama as just a straight party line Democratic vote, and now in Congress, they're only doing it with only the Republican caucus. Yeah,
I mean that's not, neither one is the approach to something that will improve health in this country for the long run. Last night at the session, Joanne Keenan was talking about the natural progress that you see in legislation, where you'll have a bill and then you'll see over time improvements of that bill across Congress. But that isn't something that appears to be likely to happen. I've never seen the nation as divided as it is, and that leads into one of the things that I'm hoping to be able to do at the foundation. And I really see an opportunity for us to be a trusted, nonpartisan voice around health. And in the current climate, that's incredibly important, because you see people on both sides of the aisle just listening to their own voices. And the Robert Wood Johnson Foundation has had a long history of being nonpartisan, of focusing very clearly on improving health, and has worked very well with people from both parties.
You talk about a culture of health, which is something we discussed here a few years ago. Yeah. How does the Robert Wood Johnson Foundation want to sort of promote that in a nonpartisan way?
Well, when I think about the culture of health, I think about it in many ways as a general pediatrician. I'm a general pediatrician. I practiced pediatrics through my entire career, and always as a volunteer and in community clinics. And so in New York, I had a community clinic I worked in Harlem, and 80% of the kids I saw were in foster care. And I remember this one grandmother, very typical situation. She was the foster mother of two kids, preteens, 7 and 9, and she wanted for her children what everyone wants for their children. You want them to grow up and have an opportunity to be healthy, to succeed in life, to reach their potential. And as a pediatrician, I would talk to her about all the things that kids should be doing. Eating right and exercise and working hard in school and talking to her about her experience. Well, they didn't have access to a park to go outside and play in. The neighborhood wasn't safe. There wasn't access to the fresh fruits and vegetables that were on the lovely chart on our wall with the food plate. There wasn't in school the kind of environment that was going to let that child succeed and excel. And so when I think about a culture of health, it's making sure that all of those components are there to allow everyone to reach their full potential in terms of health and well-being. And what it takes is a vision of health not just occurring through that interaction you have with your doctor, but your interaction through the whole community, and thinking about how do you pull together parts of the community that haven't necessarily thought of their role as part of health, and get them to be part of the solution. It's this community-wide approach to health.
Well, when you talked a moment ago about the Robert Wood Johnson Foundation taking on more of a role in this deeply partisan time, give me some examples we do that here right now in this room, but give me some examples of how you will do that.
So over its history, the foundation has been a convener and has been able to pull groups together across in the way that Aspen does, and that's going to continue. But I just finished almost 8 years as ABC News chief health and medical editor, and I went there from the CDC, and the reason I went to ABC was in 2009 when I was the acting director. It was during the swine flu pandemic. I was doing a lot of media work, talking to the public about what to do to protect themselves during a crisis, giving people information about what was happening, what we were doing to try and protect the public, giving people action steps that they could take. And what we were seeing, we saw polling work being done by Harvard, that people's trust in government was as high as it had ever been seen during a public health crisis. Their knowledge about what to do to protect their health was going up and up. And it struck me that there was a real opportunity for public health to go retail and to reach out directly to the public around all kinds of health issues. So for those 8 years at ABC, I tried to do retail public health through the camera. I think for the foundation, there's a real opportunity to use our voice more. When I was announced as the new head of Robert Wood Johnson Foundation, people who knew the foundation, I said, well, do you listen to NPR? And they said, yeah, that's where they had heard of us as a sponsor of NPR. But then I'd say, well, do you know what we do? And it was like, no.
Sponsor NPR.
Yeah, we sponsor NPR.
NewsHour.
Exactly, yeah.
We have Judy Woodruff here to
yes,
say
that is one of the things we do. Then other people, because I live in New Jersey and Robert Wood Johnson health system is the biggest health system, they would say, finally I can get an appointment in New Brunswick. Yeah. But my favorite was a woman that we'd hire to walk our dogs when we'd go on vacation. And she looked at me very seriously and she said, my parents donated their bodies there. Ooh. And I said, I think that's the medical school. But I went back to our facilities guy and I said, when you gave me the tour, you didn't show me the morgue. Yeah. But I,
But real quickly, just so people know, it is a legacy of the Johnson & Johnson Corporation.
That's right. So Robert Wood Johnson II, who built the Johnson & Johnson Corporation into what it is, left all of his money to set up the Robert Wood Johnson Foundation with a broad, vision of improving health for people in this country, in particular the most vulnerable. And so that gives us, an incredible bandwidth in which to operate and think about, okay, wow, we have a lot of money. How do you use that most effectively to improve health in this country? And I think that if we develop a voice that is respected not just by the people in the room, the people who work on health, but by the public, we'll be able to leverage and increase the impact of what we do.
And might you even try to do what you said about once all this Affordable Care Act debate has settled down a bit, say, okay, now how do we get together and actually fix healthcare in America?
Yeah, definitely. That's something that we work on all the time. We do a lot of work at the state level. As states are getting waivers around Medicaid and are looking at new ways to use that money, we want to make sure they're getting technical assistance to be able to use that in a way that will benefit their population as much as possible, that people won't be losing services, but maybe they'll be able to come up with ideas that do provide better health care at lower costs, and those ideas can be shared.
Give me an example of an idea for better health care, lower costs, that's not some politicized idea, but if you could sort of with a whiteboard say, let's change this.
Yeah, I think a lot of it ties into prevention and understanding what the things are that drive disease that we're seeing, so that you would be able to, as a healthcare provider, not just get compensated for treating someone's high blood pressure or their diabetes, but you would be able to get that patient into a program that is providing within the community things around nutrition and physical activity. Those are things that do pay off in the long run, but our healthcare system is so set up around fee-for-service. The more times you see a patient, the better you do, that there are disincentives there to doing the right thing.
For the 12 years we've been doing this, every conversation says the healthcare system is so set up for fee-for-service that it's a disincentive. Yeah. How come we don't fix it? I mean,
yeah.
there used to be more. When I was young, I was in a HMO,
right.
But see, we seem to be going the wrong way. Why can't we fix that?
Yeah, if you haven't read Libby Rosenthal's book, I'll give a plug for An American Sickness, because she really breaks it down and looks at all of the components of the system that are set up in the wrong way in terms of where the incentives are. And it's going to take a big move in Washington and people on both sides of the aisle to agree that it's what needs to happen. I was talking with someone earlier today who's an executive in a large corporation, and was saying that their annual health care bill was over $2 billion, and that's unsustainable. So I think there are enough reasons to fix the system that if we can get Washington off of its dysfunction, there's some progress that can be made.
Well, that's a strong if. Can't we have enough? I mean, you said it's unsustainable. Einstein once said, if something's unsustainable, it won't be sustained. Yeah. Why isn't there some other way than getting Washington to fix us to get us out of this fee-for-service trap?
Well, I mean, that's a terrific question, and one of the areas that we fund research and smart people to address. I think that right now, a lot of the action is going to be at the state level. And looking at different state models to move away from that, because there are states that are moving away from a typical fee-for-service model, and hopefully we can learn from those examples and find ways to get.
And what could Robert Wood Johnson do? Like find some community and say, hey, do it?
Well, that's a great question, and one of the big questions is when you see something working in one place, how do you get that to be taken up elsewhere? And it's really, really hard to look at to find things that work all the time. The model of investing a lot in one community and get everything to work, and then saying to everyone, here's what you do, that doesn't work that often, and so. Systems change is one of those areas that we've invested in a lot and will likely continue to do.
One of the other things always mentioned is that having an employer-based coverage model is like a really bad idea, a legacy of World War II.
Yeah.
What type of model would you go to?
Wow. One of the things I'm learning in this job is to say, wow, that's a really good question. You have to think about that. And that is a really good question. And I think that there are many different models that you could look at. When the Affordable Care Act was being framed, and during the election before that, there were all kinds of models that were proposed. The U.S. is an outlier in terms of developed nations, in terms of how we provide health care. And when you look at what we spend on health care and you look at the outcomes in terms of health and compare it to other major industrialized nations, we're not getting the bang for the buck. there is a real myth in this country that our healthcare system is the best in the world. It may be very good if you've got the resources to pay for it yourself, but in terms of overall health of a nation, we're nowhere near the top. And that should be unacceptable to people.
Mm-hmm. And especially now that we have an economy that's moving away from full-time jobs and careers that you stay in for 20 years into a more gig and on-demand economy, when you don't have health care that comes out easily, is available outside of employer base, it clogs up economic growth and entrepreneurship.
In a big way.
You've been on a listening tour for how long, a month or two?
Well, this is the first time they've let me out of the building, which was, I'm starting in the foundation, and I have to say that it's just an amazing place to be. I've worked in government and academia and in media. I've never worked in a place that was so happy, it's just.
Well, you've worked in government, media, and academia.
I know, yeah. So my benchmarks may be a little off, but it is pretty incredible. So I've been spending a lot of time going around the foundation, talking to people, and what I get and really connect with there is just this passion, this incredible passion for improving health in this country. And it's just an amazing feeling. It's one of the reasons that I decided to move on from media. I think that there are real opportunities for impact when you're working in media and reaching to the public. But there's also this dissonance working in a culture where the values and the mission are so different from my own. My passion is about improving health, and that's not what a news network is focused on. It aligned quite well every time there was a pandemic.
Yeah, right.
But apart from that, it was sometimes a stretch. I'm just starting to get around and talk to people, grantees and other people, and what I want to hear is what people think we should be focusing on. How can we be a better partner? How can we be better in terms of our relationships as a grantor to a grantee? And I'm hearing a number of ideas. And when I took this job, Risa Lavisa-Moret, who was the head, said that I would never be as popular and my jokes would never be as funny.
Yes, right.
as they are in this job. And I think she's correct. But
what has surprised you or been your biggest either disappointment or happiness moving into this whole new realm?
Yeah. The happiness for me, I love a really steep learning curve. So when I moved from CDC to ABC and was, I was playing the role of a journalist, that was exciting. Coming here to Philanthropy for me is another one of those steep learning curves. I've never worked in philanthropy, and now I'm leading the nation's largest philanthropy focused on health, and I love that feeling. Just learning about what we're doing, trying to get a sense of what are the levers that we have in philanthropy that are different than they were in government. I was in government for 13 years, and for us to push forward on implementing a new program, the evidence base had to be pretty deep. And I'm an epidemiologist, and I love data, I love numbers, I love looking at evidence. Philanthropy is a little bit different in terms of the quality of evidence, the ability to take risk, and it plays a very special role in that way, that we're able to try things that others might not be able to and see, does this work? And that's pretty exciting.
Well,
the part of it to me that's a little frightening, being new to philanthropy, is the lack of accountability in the way that I'm used to in other areas. We have a terrific board, but that's a very different type of accountability than we had, say, in government or in other areas where you know, if you're the one receiving money and you're being asked to deliver on something. Here, it's an incredible responsibility to think about how do you spend this amount of money in a way that's going to really impact on people's lives.
Well, that gets back to what you just said about being able to take risks. One of the issues for philanthropies and foundations is whether or not they should be more driven by metrics and accountability and testing the way, you know, ABC News would every night.
Right.
You'd know exactly what worked and what didn't. Others argue that maybe that's one of the great things about foundations is they don't have to say, here's how we're going to measure success and be as rigorous.
Yeah, I think it's both. You don't want to be making all your decisions based on the fact that, wow, this sounds like a great idea. It was seen in a small area, we're going to invest a ton. You want to make sure there's the opportunity for innovation and trying things that could be risky. But you also want to make sure that when you're investing in a big way, there's some evidence to show that there's value there. The other wonderful thing about philanthropy is that you can stay with a problem for a long time. At CDC, the timeline was about 2 years or less, because we would have to go back to Congress, and Congress wanted to see that there was a return on the investment that they'd given us. And so it was very hard to get money for things where you wouldn't see the return for a decade. In philanthropy, you can stay with something for a decade. You know, our big bet on childhood obesity of $1 billion, that's a lot of money over a long period of time to try and move the needle on a problem that has so many different factors that are driving it. And
But
that's
to put on your CDC hat, where you would analyze an epidemic, a problem, know everything, and put it with childhood obesity and the money you just said you put into it, how are you saying this was effective, this was a good return on investment, this wasn't?
It's really, really challenging. One of the things we talk about a lot is the issue of attribution versus contribution. You know, how much can be attributed to the money we spent versus is there enough evidence that we've contributed to moving things forward? And if you're taking on really big problems, if you're talking about something like culture of health and trying to change the way people think about health, you better be comfortable with contribution, because you know you're never going to be able to measure that you specifically through what you did move the dial. If you pick a very small problem, the smaller the problem you pick, then the easier it is to say that this moved.
Have you ever done A/B testing, or would you ever do that? Well, where you say, okay, in this community we're going to do it, and in this very similar community we're going to do something else or not do anything, and then test the results in two communities, or is that somewhat ethically problematic?
I don't think it's problematic. I think that there are ways to do that that are not, where you're collecting information on similar communities and seeing what happens. I think that there can be real value in that. The thing is, it needs to be community driven, and if you're going to do something like that, co-creating the intervention, working with the community, making sure that you're meeting the needs of that community are absolutely essential. One of the biggest things that we're focused in all of our work is health equity, and trying to work towards a world where we're not seeing the major disparities that we see now in terms of health outcomes. When we talk about health equity, we're talking about people having the same opportunity for health and well-being, regardless of where they were born and what their race is or their religion or who they love, that everyone has the same opportunity. And that's a thread that winds through all of our work. You know, it's something where it's going to be very hard to ever get attribution that focus on that is making a difference.
That would seem to be very a specific issue when it comes to childhood obesity and diabetes, which in some ways varies quite a bit by zip code and
That's
by
right.
socioeconomic. In fact, Bill Resnick's here, his family, Lyndon Resnick, and have been incredibly successful in the Central Valley of California after a lot of persistence in moving the needle on both diabetes and childhood obesity. What have you seen that's worked in low-income communities or underserved communities on that topic?
One of the things that we're starting to see nationwide is in younger children in particular, a decline in rates of obesity. And that's very exciting given the more than 20-year history of rises. In older kids, you're seeing some leveling off. The factors that drive obesity are similar, I think, across. And touch on some of the things I said before. Are children having access to healthy foods? Are they having access to physical activity? Are they in an environment where the opportunity to have a healthy meal is there? There's also big unknowns. So when you look at low-income children, the WIC program is a big provider. So have changes in WIC had something to do with improved nutrition. I have to say, though, that the conversation that I have with parents in my clinic over the past 10 years has changed dramatically. In terms of, I always ask, how many sodas does your kid have a day? And early on, it was always, well, 2 or 3, or the number was definitely more than 0. And now, over and over again, it's, no, my kids drink water. There's this, I think there has been a culture shift that sugar-sweetened beverages really aren't good for you and shouldn't be something.
And why did that, the First Lady, Michelle Obama, pushed that enormously. Drink water, sugar-sweetened. Did that type of public thing help the shift? And are you worried that it'll go back now that there's been a reaction against the Michelle Obama programs?
It's pretty challenging to determine what leads to a culture shift around something. As we talk about how do we create a culture of health and a different way of thinking about health, there were a lot of different groups, a lot of moving pieces that have all been focusing in on the issue of sugar-sweetened beverages and sodas. That's an area that we have a lot of interest in. But when as we talk about that problem, and the message to families and children is you should be drinking water, we have to then look and say, okay, what's the water that they're having access to? And when you have issues like Flint and people can't turn on their water and drink it in a safe way, that leads to another issue of, okay, if we're pushing a message of drink water, we need to make sure that the infrastructure is there in our cities and our communities to provide clean water. So if we're looking for infrastructure projects, that's a good area that could create jobs and improve health.
What else are you looking at going forward to Robert Wood Johnson? What excites you?
I'm in that listening phase, and there are so many health problems that we face as a nation, and so many to choose from. I really like the approach that we have with our county health rankings. So these are rankings that come out every year, where and you can go to countyhealthrankings.org right now, put in your county, and it will give all kinds of health metrics for your county. You can then look and see what are the drivers of those health metrics, and then as a community, you can come together and decide, okay, here's what we want to focus on, here's what we want to address. I'd like us to really continue to build that out so that we've got more and more tools for communities that have decided, okay, we want to take on addiction. We want to take on obesity. We want to take on violence in our community. And they'll have the tools that they can use. And then one of the things we can do is evaluate, is this model really working? Is it moving the dial in these communities? Bill Frist, who's on our board, is working to try and do this in Nashville in a big way. He was saying to me, he looked at the county health rankings and said it was absolutely unacceptable that they weren't ranked.
Nashville?
Yeah, in Nashville.
That's got the biggest healthcare system.
Exactly, and that's what he said.
It's university,
Exactly, it's got all of these components, and it's not ranked very highly in the state.
Even got good music, you would think. Yeah.
So, he's driven to move it up, and we'll see if he does it. But it's a great example of using the data to try and drive action in your community. You
mentioned two things just a moment ago that are sort of public health issues, and I wonder if you want to see them in your purview. The first is opioid or other addictions, and the other is violence.
Yeah, I think they're both incredibly important public health problems. I think our approach to those issues right now is providing the tools to communities. And so, there are some of the Culture of Health Prize communities that have taken on addiction and have looked at models of ensuring that naloxone, the antidote to an overdose, is available in all first responders, providing safe places for people to come where they won't end up in trouble with the legal system if they are dealing with an overdose. And so providing tools in that way so that communities can have some choices and know some models that work.
Mm-hmm. Let me open it up, because, especially to any questions about health and policy before you start asking, for specific diagnosis or something, like your back is hurting. Ralph Wanger, our old friend, yeah.
Hi. It sounds to me like you have
That's all right, keep talking, they'll get it.
one of the most enviable jobs in the world at this point.
Yeah.
But I haven't heard your mission statement yet.
Yeah.
And I hope you have or are working on one which will define what you do that is something that government isn't doing,
Right.
and something that industry isn't doing, but something that you as a private foundation can do because of your different time horizons, your different your lines of control and so on. And do you have a very specific set of principles that you
Good question, Ralph.
Yeah.
have found?
Great question. So, our overarching vision is to work towards a culture of health in this country where everyone has the opportunity to lead a healthy life and achieve their potential. Within that, there are areas that we're focusing on right now, and those include obesity. Those include building healthy communities by trying to spur investment, pulling groups together in communities. We have a lot of work around transforming healthcare systems and linking healthcare systems to public health activities, and then a lot on leadership development. One of the things we're looking at is, okay, how do we pull this together in a very cohesive story to talk about, all right, here's how this array of work leads up directly to creating a culture of health. Because when you look at all of the things that it takes to make this a healthy society, it's massive. And it's very important for us to focus in on areas where we can really make a difference and not spread our resources too thinly across every problem that's occurring in the country.
But when you spoke earlier of Mr. Johnson, the original Robert Wood Johnson, he said he'd given you the charge of equity.
Yeah.
Is that still core to your mission, to make sure that the poor have more equal access?
I mean, it's absolutely central to everything we do. So whether every area that we're working on, we want to make sure that in the way we do that work, we're ensuring that the most vulnerable are front and center in our work. And that's critically important.
Yes, but we'll go one at a time, whoever gets it first. But you'll get it next,
Great.
and then.
Thanks so much for opening yourself up to questions. And so I have to say thank you to the foundation, because I have been a recipient as a grantee for the last 18 years, probably 6 different
Why
awards.
don't you tell us who you are, too?
Well, right, I am Ramana Hasnain Winya, and currently I'm the Chief Research Officer at Denver Health, which is a health system that, as many of you know, takes care of all, regardless of ability to pay. So I know that the foundation has really invested in equity, because that's the work that I've been doing for all of my career. My question is about your training programs, however, because I think it's really important, and it gets to the point of, where is the federal government going to go? Where is federal funding going to go in terms of training? So, for example, the Harold Amos Faculty Development Award.
Right.
Have mentored a handful of really just terrific people through that program, and I'm curious if that's something that you see continuing. And then also I know that the Clinical Scholars Program, which was sunsetted a while ago, which is also just has produced a great number of leaders in the country, many of them who have done research and great work on equity, whether that's something or some model like that, whether that's something that you're thinking about
And will you hand the
continuing.
mic to the woman right in front of you,
Thank
who
you.
had her hand up, too? Okay,
I think leadership development is absolutely critical. And when the foundation made a decision to sunset the clinical scholars program, it was in conjunction with starting up 4 new programs around leadership. And the reason for that was the recognition that not that there was any deficit in the clinical scholars program. I'm a major fan of that program and have worked with incredibly talented people who've come through that program. But a desire to train a cadre of leaders who are really skilled at working at the community level, and different leaders across disciplines. So yes, some from health, but maybe some from housing and some from transportation and other fields that would be coming together, working on projects within their community that cut across these sectors and getting strong mentorship to learn how to do that in an effective way. That's one of the programs. There's a program that focuses on health policy that takes in underrepresented groups and gives them training around health policy so that they can be the next generation of policy leaders. There's a new formulation of the clinical scholars program where teams come together across health disciplines. So you may have a physician and a nurse and an audiologist who are coming together and have recognized a problem in their community and are trying to address it. So we're not moving away from leadership training. The hope here is that this new group of leaders will serve a different role and help move the country forward in the ways that we think are really important. I'm really glad to hear that the clinical scholars program, that there are universities who saw such value in that they're coming together to continue that program. And that's one of the things as well with philanthropy is that, you know, if you can create something that has then proven value and then others step up to keep it going, that's a win. Because then you have resources to try something else and to move forward. And the Harold Amos program is absolutely terrific, and I would see no reason to stop that.
Mm-hmm. Yes.
Okay, thanks. This was terrific so far. My question just is back to a sentence that you'd said before that I really hope is true. You want to be able to sort of be outside the politics and be a nonpartisan voice in health. But as I thought about that, while I dream of that, how do you do that? Health is just inherently political. Where do we put our resources and who gets them and who pays for them? Just seems inherently. So what are some of the strategies you'd use to make it less political? Yeah,
it's a challenge, and that's an area where we're just starting to have conversations within the foundation of how you do that. I personally think that you do it by sticking to the policy rather than the party, sticking to the evidence and what that shows. It's the way I approached issues at ABC News. When there would be a story that was rather controversial, I'd look at the evidence. So new guidelines around prostate cancer screening that said no longer recommended based on this test. Well, look at the evidence, come forward and provide that information and try and give people then information that they can use. When I think about being a trusted nonpartisan voice, that's very different than not having an opinion. You have opinions. You have opinions that are based on the evidence and your values, and you stand up to that. So, one of the things that we're talking about within the foundation is, okay, let's discuss our values and our principles so that there's real clarity around that, because that really gives you then the guiding light for when you really need to stand up and say something and when you don't, because you have to be careful about how you use your voice and where. And when I think about a trusted voice, there are different audiences that you want to be a voice for. So you want to be a voice for the policy community. So when legislators are thinking about a policy, they turn to us as one of those groups that plays it straight and calls it based on how we see the research and the evidence. But you also, I think, want to be one of those trusted voices for the public, because there's so much noise. I think there's room for that.
Yes.
Hi, I'm Janine Belfour. I'm with the Conrad Hilton Foundation, and we fund in a number of different areas. One of them is substance use prevention, and I just wanted to touch on that a little bit. I actually don't lead that work, but it is something, you had discussed a little earlier about the issue around the opioid epidemic that's happening. There was a conversation that just happened around that where one of the speakers discussed that many of the issues that are plaguing the mortality of Americans are behavioral, one of them being around alcoholism. So I'm just curious, because Robert Wood Johnson used to be a big funder for substance use prevention. You had discussed how prevention was a priority for you,
Right.
and now we're addressing these behavioral issues that are focused on substance use. So I'm wondering if you're considering bringing that back into your funding as a priority for longer mortality.
Mm-hmm. Yeah, at this point, I'm really in that listening phase, and yeah. I mean, to be fair, I'm 2 months in, and there are so many health issues that we face as a country, and as a country, clearly, addiction and opioid use is one of those really important issues for us to address, and we as a foundation have to look at that across all the other things we're looking at to see, okay, is there a sweet spot for us there? Is there something where we could be effective in helping move that forward? Right now we're trying to do that through the work we do through the county health rankings and providing technical support through that for communities that are looking to address that issue. Here at Aspen, we just finished a meeting of the Aspen Health Strategy Group, where we just spent almost 3 days
And
talking.
Vivek Murtha was very much
Yeah.
talk to you about that issue.
It's
Yeah.
terrific. And we were looking at solutions that might be nonpartisan, might be able to get some traction to address some of the issues around that. And clearly, it's something that
You might want to
address.
report, the whole 2 days really was on opioid addiction.
Exactly.
And
Yeah.
you might want to report out a little bit about some thoughts that came out of that for
Yeah,
you.
I mean, there were a number of issues. One is a real need to change how, as a country, we prescribe opioids.
I'm talking about addiction.
Yeah, no, you were
Yeah,
talking
yeah,
about substance. I was just
yeah.
trying to turn it back to
I mean,
the
founda-
painkiller one.
The
yeah.
foundation, I think for about 20 years had a major investment in addiction, and opioid clearly is a subset of that. But if you're going to address some of the prevention issues around opioids, you have to be addressing addiction at the bigger level.
In the back there, yeah. Can't quite see, so.
Hi, I'm Melody Mccoy with Japigo.
Mm-hmm.
And I would just like to say we were smart before you were at Robert Wood Johnson Foundation. He was the first recipient of the Visionary Award as a champion for maternal health. So love to see you in this job.
Thank you.
Just as the maternal mortality rate has risen in the United States, wondering if that's on your radar to address at your new position?
Again, it's one of those things I'm listening to. I'm going to be very careful not to commit to any new program areas here. One of the things I've been told is that if I smile when someone mentions a topic, they may take it as a sign that that's where we're going to be.
Rich promised me you were
Yeah,
going to go
exactly.
into, yeah.
So that is a really important issue, and it's also a really important issue when it comes to disparities in equity, because in some populations, maternal mortality here in this country is worse than it is in some developing countries, and that's unacceptable.
So I think in your old ABC job, people would keep coming up and saying, I've got a ringing in my ear, can you look into it?
Yeah.
Now they're looking for grants.
I was the in-house doctor for ABC News, which
Oh, that must have been a...
well, it was when I took the job. Tim Johnson was the doctor at ABC,
Right.
and he said, Rich, one of the things you're going to find is that everyone will come to you with all their medical problems. And I said, Tim, I'm a general pediatrician. That's not going to happen. But he was so right. It was about a third of my job.
Every correspondent at ABC News still remembers their pediatrician and likes them
Yeah,
very, very
exactly.
well.
Yeah.
Yeah, Shauna?
So I'm a huge fan of the Future of Nursing, the Campaign for Action. And it just seems like that is such a wonderful resource to be able to scale. One of the interesting challenges is the current education program really is educating nurses to go into the clinical settings and not really out in the community.
Yeah.
So what are some of the things that you guys are doing in this program to address kind of the changing landscape of where nursing can really deploy their skills to reduce cost, increase access?
Yeah. I can't comment on what we're doing. No, because I don't know. I'm still getting read in a lot, but I can tell you I'm a big fan of the work we're doing around nursing. I think when you look at shortages of health providers in this country, nurses and nurse practitioners, physician assistants are a big part of the solution to that. And the work we do around nursing has been a really important part of what we've done for a long time and will continue to do.
Let me follow up on that without your Robert Wood Johnson hat, but just as a doctor, pediatrician, medical field. You just said that with the shortage of doctors, nurses and nurse practitioners can fill a greater role. How do we make that happen, and what are the barriers to that?
Yeah, I mean, it's another one of those issues. Getting back to the Affordable Care Act, it didn't address cost. It was really about access. And if you look at what people are going into from medical school, they're not going into primary care. And what we need in this country are people to provide primary care services. And that's not just physicians, but it's also nurse practitioners and physician assistants. It's those individuals providing direct care, but also through using technology, through telemedicine and other ways. But there are parts of this country where people do not have ready access to medical services, and that's.
But could you move the boundary of what's supposed to be done by the doctor and what's supposed to be done by the nurse practitioner to give the nurse practitioner more of a role and thus keep costs down too?
I think definitely.
But is there some legal or regulatory?
Well, yeah, definitely.
Or insurance, or
all of those. Yeah, there are issues around scope of practice and that are challenging to work through, but need to be. You look at where the money flows, and there will be resistance to it flowing elsewhere. So. Yeah? Yeah. So, you have to look at what's best for the country and figure out how you get there. But, I learned more from the nurse practitioner who worked in the clinic when I was a resident, I think, than a lot of the doctors there, because the focus of the training was really on connecting with the patient as an individual and sitting and listening. And so much of the value in an interaction with a healthcare provider is the time that you're sitting and talking and listening, and not the time you're getting examined with a stethoscope.
Mm-hmm. Okay, both of you there, one at a time, since the hands are almost joined. Yes, right.
Thank you. One of the tenets of Robert Wood Johnson Foundation has been uncommon partnerships, and I was wondering if you could talk about in your early time there, how you were thinking about that going forward.
Yeah, I think when you think about what we're trying to accomplish, partnerships are incredibly important, and thinking about new and different partners is really, really important. We have a tremendous partnership now with the Y, and that's incredibly important because the Y is not just the place people go to shoot hoops and swim laps. It's a place where people go for diabetes education and to have their blood pressure checked, and where 100,000 kids get nursery school and preschool. So that's an incredible opportunity. We've been working with 4-H, which is a real big player in rural communities. One of the H's I learned is health. Right? Yes. The person who told me that is here in the audience. I didn't know the H's. Does anyone know the 4-H's? There we go. There we have it.
Carrie, what is it again? Again?
Head, heart, hands, and health.
Head, heart, hands, and health.
Yeah. So that's an incredible partner. And then we have partners that we stand up and speak with. when you look at our obesity work, I'm going to forget the name of the partnership, but an incredible partnership of ex-generals and others in the military who are very concerned that something like 70% of young people are unfit to make it into the military. And so there's a group we can partner with around that issue. So, and the business community are critically important partners for all of the reasons we've been talking about in terms of cost, but also their desire to be working in communities where their employees want to live. So they want to be in a healthy community. J&J is one example. Campbell's in southern Jersey. GE, places, large corporations that are seeing there is a reason for them to invest in their community that could hit their bottom line in a good way.
Brian Uppel, New York University. I'm not going to ask what you're going to fund, but I do want to know what you want your legacy to be. When you step down in X years, what do you want us to look at you and think of you about? Yeah.
Yeah. I want the program of, oh no, I'm not going to say what it is. I mean, I want to be able to say that the health of people in America has improved because of the work that we've done during that period, and that all people in this country have a better shot at living their healthiest. And there are a lot of ways to get at that, and it's all about that mission of improving health. I am so early in the learning phase. It's coming here is terrific because people give a talk and say, and my work was funded by Robert Wood Johnson Foundation. I'm like, really? That's somebody I need to talk to. So yeah, it's all about improving health.
Mm-hmm. In the back there, and then Carrie, yeah.
So early on in this process, you talked about how long it's been in the switch from fee-for-service to value-based care. And a little bit later, you talked about the switch and the timeline that you're looking at going from the CDC to where you are now. And it seems to me those are the same thing, aren't they? That, when you look at acute care, if I'm having a heart attack, I need care now. And that's very immediate and apparent, but the prevention, the things that you really want to focus on with value-based care is something that you're hoping is going to pay off. For somebody who's younger, 20 years from now, they won't have that heart attack. And so how do you get beyond that mindset?
I'm not totally clear on your question. I think that both factors are important in terms of access to care now for the medical problems you have, and then looking to make sure you have systems that will focus on prevention. Is that what you're getting at?
What's the relative investment in those two aspects?
Yeah, and that's what we have to decide as a society. Betsy Bradley, who asked a question before, has done a lot of work looking at the relative investments in social services and prevention versus acute care. We don't stack up very well with a large part of the world in terms of how we do that. And my understanding is that the current version of the Senate bill knocks out the prevention fund, which is not the direction that I think would lead to more prevention.
The way you so carefully phrase that does lead me to a question I refrained from asking earlier. When you said you wanted to be an evidence-driven, nonpartisan voice,
yeah.
Do you feel that could be a problem at times when there's one particular either party or segment that is less in that camp?
It definitely makes it challenging, but I don't think it makes it impossible, because when you look at the issue of healthcare, it cuts across both parties, and there is a desire to improve health, and so it's trying to find where's the common ground. And looking beyond the politics of who's winning and who's losing on an issue. But it is really, really challenging.
The winner of our 4-H Trivia Award gets the next question.
Well, first, thank you for the opportunity to email all my old 4-H friends and tell them I got to show off with
Yes.
that. It's been a lot of years. But we're just on the same topic of being the nonpartisan trusted voice for people. There's an interesting overlap with your background in the media and how the media has evolved in just the last few years, and how people are consuming their news, and how they're understanding the reality of things that are going on, and what's fake news, and how much depth they understand in these systems. That's not traditionally, as I understand, been a focus of the foundation. But do you have any plans to leverage kind of your background and your expertise in media in any interesting ways that might actually enable you to really play alongside them or counteract some of the trends of the media?
I hope so. It's one of the things that I can bring to the field that isn't there. It's really concerning to me as a physician and a scientist, the way facts are now treated as kind of it doesn't matter what issue you're talking about, whether it's vaccines and their value or other issues. The idea that science has lost some of its clout, that we don't raise a question and then try and address it with science to come up with an answer, and that people will accept that. That's really concerning, and something I really do want to think about is how do we regain the trust of the scientific community. I was talking to someone in internal medicine who's very concerned that doctors are not trusted by their patients in the way that they used to be. And I'm not saying that the old relationship of you come in, you present, and you're given the word is the way to go, but the idea that the facts and the science, when they're clear, are viewed as just an opinion is really concerning.
What is the cause of that? I mean, the past 20 years.
I was going to ask you what the cause.
Well, I have a lot of opinions, but they didn't come to hear me.
Yeah. I don't know.
I think it's the fluoride in the water did it.
No. Yeah, I mean, but some people would say it was the fluoride in the water that did that. And well, I think social media is part of it, and the ability to amplify opinions and to couch things in a way that make them look like they're not opinions but fact driven. It makes it much harder. I mean, there's so many wonderful things about being connected, but one of the hard things is having to refute the information that's out there. And I spent a lot of time on ABC. Countering stuff that was out there, about this diet or that diet or this bit of information, and fact checking it, saying, here's the truth on that.
Right.
Yeah.
Well, that's what I would have said. That somehow or another, the fringe and conspiracy theories that have always existed. I mean, I can remember the anti-vaccine feelings of the 1770s and 80s with Cotton Mather, but now they have a platform to spread on social media and the internet. And people see things on the internet, and they think, "Wow, that's the facts." Last question, way in the back. Make it a wonderful, grand, general question that can be our finale.
That's a lot of pressure.
A lot of pressure.
Yeah.
So I do want to stay on that same line. I mean, the other thing that's happened that's allowed misinformation to proliferate is that journalism has become a lot weaker. So is there a way that Robert Wood Johnson could, rather than maybe focus on journalism and making journalism stronger, especially in local communities? Like if you think about the local health reporter for the local newspaper, he or she doesn't usually do much to give the community a description of how healthy their delivery system is. And I just wonder if there's a way to counter that misinformation on a local level.
Yeah. I mean, you actually, as we've said, NPR, PBS, NewsHour, Robert Wood Johnson is very much in the forefront. So is that something you enjoy and want to see more of?
I mean, I think getting fact-based information out to people is really important. But thinking even broader of where people are getting their information and meeting them there. When I was at ABC News, I would not just do work for ABC News, I would be on Entertainment Tonight or Inside Edition. and people would say, why are you going on entertainment shows? And so because that's where a lot of people get their information. And so every opportunity I saw or had to go somewhere and meet people where they were getting information, I took advantage of that. And if people are getting a lot of their information out on the internet through various forms of social media, we need to meet people there and not say, oh, I don't do that because it's social media. There's a lot of great information out there, and we can help amplify that and curate it in a way that allows people, if they trust you, to go along with you for the ride.
Well, you spoke earlier about your partnerships. We're proud to be one of your partners. Thank you, Rick.
Thanks very much, Besser.